Hi, my name is Yolanda Caporelli, and my topic for the Health in Real World project is cystic fibrosis. For a preview of this presentation, I will be giving some background information, the diagnosis and assessment process, the treatment, the daily lives of both patients and those around them, and then other fun facts. So first, background information. The definition that I compiled based on multiple resources is that it is a recessive disorder occurring in the mutation of the CFTR protein that causes extensive damage to the lungs, digestive system, and other organs. Key characteristics are that mucus, sweat, and digestive fluids are made to be thicker, and it causes clogs in the tubes within the lungs and pancreas and other organs. The prevalence rate for cystic fibrosis is that there are 30,000 cases in the United States and 70,000 cases worldwide. In 2007, the median predicted survival rate was 37.4 years old, with 95% of patients dying from complications related to pulmonary infections, with females more at risk for mortality than males. Symptoms and signs of the disease are put into two areas. The first is respiratory, with persistent cough, with thick mucus, repeated lung infections, recurrent sinusitis, and inflamed nasal passages. The digestive part is foul-smelling, greasy stool, poor weight gain and growth, and chronic/severe constipation. There are 6 variations of the cystic fibrosis disease, and they're all kind of defects in the protein or reduced quantity or stability of it. And these vary in severity as well. Some get it more severe and others less. The diagnosis process and assessment for cystic fibrosis consists on the symptoms and a result of newborn screenings, sweat chloride testing, genetic carrier tests, and clinical evaluations. The specific names for these assessments are the NBS, the newborn screening, the sweat test, done at a CF Foundation accredited care center by measuring salt in baby sweat, and then the CFTR relation metabolic syndrome, that is done if there's a positive newborn screen test, and as well as a borderline result in the sweat chloride tests. The treatment for cystic fibrosis are multiple. There are medications and tools which include antibiotics, mucus thinning drugs, bronchodilators, mechanical devices to loosen up mucus, which are kind of like vests that shake the person to unstick the mucus. There are also pulmonary rehabilitation stuff that you can do, such as physical exercise, breathing techniques, and more education about cystic fibrosis. There are also surgical options, such as the nasal or sinus surgery or lung and liver transplants. And finally, the most common one is airway clearance techniques, such as chest physical therapy, which includes a person, cupping their hands and hitting against a person's chest and back. Now, prevention for cystic fibrosis is not possible because it's not curable, and it is a genetic mutation already present during the developmental process, but there is hope that someday gene therapy may be used to prevent cystic fibrosis. The treatments mentioned earlier are only made to help mitigate some of the symptoms that present themselves in cystic fibrosis patients. The daily lives for patients and those around them vary in health and psychological impacts, as well as the treatment adherence of these individuals. The health consequences experienced are those of the general kind, which include malnutrition, frequent respiratory infections, breathing problems, and chronic lung disease. And there are also developmental consequences, where children can fall behind milestones because of the poor health growth mentioned earlier. And in adulthood, CF-related diabetes can often occur. Now, the psychological aspect of cystic fibrosis is that individuals often experience a comorbidity with anxiety or depression. It's very common. And in families, parents that have to take on this role of being a medical parent and changing their lives often have increased rates of anxiety and depression as well. And their siblings of the patients also experience negative impacts, such as in areas of peer activities and psychological functioning, because of the different treatment that they get from their parents. There are also personality variables that affect cystic fibrosis management, such as higher neuroticism. Studies differ on this, but most say that neurotic people are really good at self-monitoring, and this aids in the recognition of symptoms and preventing some of those symptoms as well as mitigating them. Higher conscientiousness also is beneficial because people higher in this spectrum, they feel like they need to complete treatment well and thoroughly. Hopefulness also leads to better physical health, and tolerance to aversive thoughts and acceptance of the diagnosis also impact. Management and coping for cystic fibrosis is good communication with parents and providers, stress management, organizational skills, and support systems. Things that can help and make good treatment adherence are education about cystic fibrosis, good peer and familiar relationships, self-efficacy, and hopefulness and tolerance. Things that make treatment adherence poor is obviously the comorbidity of anxiety and depression, family cohesiveness and conflict or flexibility, parent-child relations, lack of knowledge about treatments, disagreement with provider recommendations, oppositional behavior, and time management. Moving on to the final portion, which includes resources, health in the news, and fun fact. Every time I searched information about cystic fibrosis, I was led to the Cystic Fibrosis Foundation, which is really neat. It has so many fun features about it. Like, they have information. It's an accredited foundation that, with the help of medical professionals, provide information in a really simplified method. They have care centers, multiple of them supported by medical professionals, and they provide resources to both the patient and families and friends and seeking help, info, and so much more. Then, whenever I looked up cystic fibrosis in the news, I found what pop culture gets wrong and right about cystic fibrosis. In 2019, 5 Feet Apart came out, and it portrays cystic fibrosis and two people that end up falling in love, and in an attempt to take control of their lives, they stayed 5 feet apart instead of the recommended 6 feet apart from other CFers. And the kind of result of this was that some people with cystic fibrosis were really upset because they were like, there was nothing that could make me risk my life, not even falling in love. And some were rather happy because the portrayal of cystic fibrosis was mostly accurate in this movie. And again, while researching CF and this news article, it made me realize that people with cystic fibrosis are actually capable of living normal lives, having careers and families, contrary to the sickly portrayal that I saw in 5 Feet Apart. And to sum it all up, cystic fibrosis is a genetic mutation that presents itself as excessive mucus that creates blockages in the lungs. CF is diagnosed via prenatal screening, sweat tests, and more. CF is not curable but can be managed through several airway clearance techniques and medication. People diagnosed with CF and those around them often experience anxiety and depression and so many other psychological factors. Factors that affect adherence are both psychological, related to knowledge, relationships, and more. My public service component for this project, I named it Cystic Fibrosis 101, a guide for parents and children. I realized that children often have trouble with understanding cystic fibrosis, and their parents also don't know how to help their children, so I thought I would make like a little book to help both the parent and child. Thank you.